Why is there a personality test in as part of the intake process for corrective surgery such as LASIK or RLE or premium cataract surgery? So it boils down to that the brain is a big part of the visual system. The brain is what ultimately interprets what you see, and if you like what you see. So some brains obviously are more adaptable and more open to experience than others. Um, and so personality is sort of a proxy to gauge if a patient would be at risk of maladapting to some of these technologies. Certainly, it's not a big factor in LASIK surgery because LASIK is really well tolerated. You're just simply changing the shape of the cornea. There's no introduction of a new technology to replace or enhance the visual system. But in RLE surgery, because a lot of times we're using multifocal lenses to restore range so that you can see near and far at the same time, this becomes more of a consideration. Um, some of these temporary side effects, such as rings at night with nighttime driving, can make some people very uncomfortable, whereas other people, they don't even notice it. So a lot of it has to do with we boil it down to just very superficial things like openness to experience, how outgoing a person is, and I almost never look at certain things that are asked, like what are, how perfectionist is the patient. Those things, you know, may be useful to some surgeons, but I don't find them all too telling. I've certainly had patients who tell me they're very easygoing, who then, are not so easygoing after surgery. But in my opinion, it's not a necessity to do a personality test. I think we like to know our patients and talk to our patients before surgery, to have a good idea of who this person is, what their expectations are, what their goals are, and then to make a good judgment about whether this is the right surgery, this is the right patient for the surgery. Whereas a self-assessment made by a patient, I would say rarely is ever very helpful. But nevertheless, in some of these practices, maybe even my own, you may see a short personality test, but just know it's more to do with having a proxy of, what, just letting us know if there are going to be any risks to the patient not accepting of the technology. And that's all it is. It's nothing more than just another piece of data. But arguably, it's not very useful. Thanks.